Jesco DG400. Specification wise, it's having a monopolar, bipolar, underwater, 400 watt, completely meant for all type of surgery, including of TURP and the laproscopy. Here come with the accessories: the pedal foot switch for the monopolar, the bipolar foot pedal, single pedal. After that, it's a surgical handle with cable, bipolar force with cord and jack, the cautery plate with cable, and the pencil switch with cord and jack. Each and everything have been reusable except this pencil, it's a disposable one. Now come with the unit. It's the on-off switch. We have attached a mains cord on the back of the unit. It's the back of the unit where you are having a mains cord. It's a monopolar pedal. Monopolar pedal have been attached only in the monopolar because of the pin. There is a 5 pins over here, and on a male character there is a 5 pins. It's going to be click over there. Again with the bipolar, you can just bipolar. It's a 3 pin attached with the 3 pin. Now start with the unit. It's a on-off switch. You can just attach with the on-off switch. The light will glow. That means the monopolar foot pedal and the bipolar foot pedal have been attached on the back. Once we remove, then the light will off. Now we add on with the bipolar. Now the light will glow. It's going to be for the patient plate. Patient plate, it's a low. That means there is no attached with the plate. Now we attach the plate. We are using this dummies. The plate we attach. Now it's going to be green light. Now that means it's going to be properly workable. The plate and the cable is perfectly okay. Yellow is for the cutting and the blue is for the coagulation. Yellow indication by yellow pedal, yellow is for the cutting, and the blue indication by blue pedal, blue is for the coagulation. For cutting, the power you can increase and decrease by 1 watt like this. If you want to decrease by 1 watt like this. If you want to increase fast, then press on, it's going to be fast increase. If you want to decrease fastly, it's going to be decrease fast. And power, the maximum output on display is going to be 400 wattage. Now you are having a different modes of cutting. One is the pure cutting, that comes with the 100% cutting. Blend 1, that comes with the 50% cutting and the 50% coagulation. Blend 2, 75% cutting and the 30% the coagulation. And in endocut, there is a pulse current for the specially meant for the endoscopy, esophageal. The tip on the current is there in the endocut, and it comes with the pulse current. Similarly with the coagulation, power you can increase decrease by this knob. If you want to increase fast like this, if you want to decrease by 1 watt like this, if you press it, it's going to be fast decrease. There is a 3 mode of coagulation. In 3 mode of coagulation, one is the spray coagulation. Without touching the tissue, you can just spray by distance of 1 mm. After that, the fulguration, and after that, the desiccation for a soft coagulation. Similarly with the bipolar, you can have a separate foot switch for both the monopolar and the bipolar. In bipolar, you can have a 3 modes. One is the micro, another one is macro, another one is cutting. For power, again like this, 1 watt increase, fast increase, 1 watt decrease and the fast decrease. 3 modes of bipolar. One is the micro, another one is macro, another one is the bipolar cutting. Depending upon the tissue, depending upon the intensity of the tissue, you can define with the mode. Now we start up. It's going to be a cautery pencil. Here we attach with the cautery pencil. The soap is there. Yellow is for the cutting power, and the blue is for the coagulation. Blue is for the coagulation. The power you can increase and decrease by this knob. It's going to be a cautery pencil. It's going to be a plate with cable. Now it's a surgical. It's a bipolar forceps cable. Bipolar forceps cable is like this. You can just remove this plate, the forceps with this cable. Attach forceps over here. 2 pins on the bipolar. You are using the blue pedal, the single pedal. Now it's going to be like this. This one. This is for the bipolar. Now with the surgical handle, if you want to have for the open surgery, then it's going to be a surgical handle with different electrodes. It's a surgical handle. Here it comes with the 4 electrodes, and it's basically for the cleaning purpose. We remove 1 electrode from the packet. Just open it up like this. Put it. Screw it up. One has to see to it, it's going to be properly tight. Now it's going to be on an active socket. Here we can put the active socket over here, and it's going to be photo operated. Yellow is for the cutting and the blue is for the coagulation. If you want to change, just open it, remove it, change the other one. Simple and easy to use. With this, if you with this, it's going to be for the open surgery. If you want to have for a laparoscopy surgery, for a TURP surgery, this port has been used for the laparoscopy surgery. Active socket has been used either for the surgical handle, for the open surgery, or for a laparoscopy surgery, or for a TURP surgery. It's going to be a pencil switch, it's going to be active socket, it's going to be a patient plate connection is there, and going to be a bipolar. Simple and easy to use. Thanks.